right, so now that we're staying on that left side real quick before we get to all the other little soft buttons, hey, we got an alarm like we said before. So what we can do is, remember, the alarm actually shows you up here, hey, we had it said alarm limits disable, and a minute ago it said we actually had, hey, check your sensor. So it's nice, we can either quieten it, but like you said, take a look what you'll alarm. So let's talk about, we did the blood pressure. Right below that's respirations and the heart rates above it. But let's talk about the PulseOx and, more importantly, the different things that encompass that.
Yeah, this probe has a lot of capability, and it'll give us a lot of readings that are very pertinent to what we do. So the probe itself.
Okay.
Application. So David, we're applying it.
The non-dominant hand is the important thing
Yep.
here. And if I'm right-handed, it's going to be left. If I'm left-handed, it's going to be right. And it's going to go into what you were about to say in a second with one of the special features that is incredible on this.
Yes, so this probe can actually give you 4 different readings.
4,
which is crazy, which is, again, very beneficial. Wow. So we're going to get into exactly what those readings are now. So we're reading actual oxygen saturation, right?
Okay.
So we're reading actual carbon monoxide percentages.
Carbon monoxide.
Yep. The actual...
SPET-MET
and actual perfusion index.
Wow.
So let's start with the actual oxygen saturation, why it's important, how it can be a misleading number, right?
Nope. Okay.
So oxygen saturation. So first, what's normal, David? What's normal oxygen saturation for us? So our protocols have changed, right?
Yes, they have. So if you go by textbooks numbers, as long as there's 96% or higher, and as long as you're looking at if the patient has good oxygenation with them.
Yeah.
So they're not cyanosis, they've got, actually talking to you, and there ain't no times 4.
Yeah. And it really goes back into, you're treating the patient on the monitor. So by all means, if you're seeing a number on there that could be higher than that normal, doesn't mean they're not sick. Doesn't mean they don't need help, right? And that goes into the misleading aspect of it.
Yeah.
Can a PulseOx be misleading?
Very.
So an example of that, what's an example of a misleading representation with that PulseOx indicator?
Well, if we pull somebody out of a house fire.
Yeah.
So if they have any type of carbon monoxide or cyanide on there, they can have an abnormal reading.
Yeah. So they could be full of carbon monoxide and you get 100% on there. Does that mean they're okay?
No.
No. That means we need to recognize what they're doing, what's going on, and adjust, right? All these vital signs, you need context. What's going on?
Yeah, because I could have a COPD of 92%. That's our normal.
Yeah. Just remember, all that's reading is arterial blood. It's arterial oxygenated blood. That's all it's reading. It's not reading respiratory effort, exactly what's going on.
And it's not showing what's actually, if that oxygen is being used on the cellular level.
Correct.
Yeah.
So just understand, don't hyper-focus on that number and say, this is going to determine my treatment plan.
Remember, look at that whole pie.
The entire pie, the big picture.
There you go.
So we've talked about the actual oxygen saturation. Let's talk about the actual SPCO, so carbon monoxide, right?
Well, hang on a second before we go on.
Yeah.
You notice right there it says SPO2.
Yeah.
So if you're looking at that SPO2, that's that PulseOx you were saying.
Correct.
So there's your PulseOx. So my PulseOx is 98%. So there you go.
Yeah, come over.
Now, let's go to the next one that you were saying.
So if you look at the bottom, there's numbers that'll kind of just go by. You have 3 different numbers.
Okay.
Again, you have your SPCO, which is carbon monoxide, you have your SP-MET, and you have your perfusion index. They're all color coordinated, so the color should change. So hopefully, the reason that we did that, it'll catch your eye. You know something's different. It's not your oxygen saturation, it's a different reading, it's a different number, it means different things.
Perfect. So in this case here, the carbon monoxide, the CO reading, is actually blue.
Correct. So let's talk about carbon monoxide just for a second and how that pertains to this PulseOx probe.
Okay.
So carbon monoxide, when will we use that? What type of patient will we see that have that problem?
So for us, what I do from a med-op standpoint, this gets put on every one of our firefighters in rehab. So I can see, are they still breathing smoke in from upwind, downwind? Did they have a violation of their mask, anything like that? It's very good when you pull any type of patient out of a fire. Or if you get to a scene, particularly in the wintertime, of 2 or 3 people sick in the house and you're like, hey, what's going on?
And that's one of those things, it's for firefighters, it's massively beneficial.
Yes, it is.
Ideation environments, what we do, we want to know if we've been exposed to those things. It gives us that capability of doing so. So knowing that it'll actually give us that reading, what are normal numbers?
Well, I was just going to ask you that. So, what, 0 to 5?
So you're looking at that 0 to 5 range, right?
Okay.
So understand, can you have a background of carbon monoxide in your system?
Correct. Yeah, if interesting, every time I turn on the engine to check off the engine, my CO monitor goes off. So you do have a normal background CO.
Yeah, what about smokers?
So I would expect to be 5. I don't smoke cigarettes, and there's no CO in this room, so I'm actually a 0.
Yep. So will this thing alarm, this thing detect, hey, this is too much?
And it should.
It could?
It should.
So that magical number, I believe, is 10, right?
Correct. And then remember, you're looking at, look at your patient.
Yeah.
Hey man, if this is 10 and my patient's complaining of headache, nausea, vomiting, hey, we need to make sure we're outside the environment. Start treating your patient.
It all goes back into context, right?
Correct.
So look at the number that you're seeing, understanding that, hey, this is the patient that I have, and applying it to the scenario that you're dealing with, right?
Got you.
So let's go on to the next reading capability. So what's the next one that toggles up there, David, that we haven't talked about?
Well, right here, it actually says SP MET,
Okay.
and mine actually says 0.8.
Okay. So what is that, David? Why is that beneficial?
Well, SP MET is your methylglobemia.
Yep.
So that right there is saying, has my red blood cell been, to make it easy, has it been changed where it cannot carry oxygen?
So it's just an issue with the capability of that red blood cell carrying oxygen.
It totally is. If you go back to the cyanide kit, it's actually taking the iron and manipulating the iron in it. But yes, so now we know it. So I'm assuming anything less than 1's best?
So anything less than 2 would be normal, right?
Okay.
So what's some scenarios that you could see this with? Like what type of patient, what type of environment would you correlate this reading to?
For me, you got to take a look. You can actually look from a hazmat standpoint, is how I look at it, hazmat, or from an ideal age, which the hazmat sort of comes back to. If I have somebody that's been involved in a chemical environment, and you all of a sudden see that they've had a lot of nitrate type of products they were exposed to, I'd expect the SPET-MET to be higher than 2.
Like organophosphates?
Organophosphates can be one of them. Any type of I know the chemical plant right there off Chastain Road that does all the ventilators and stuff.
Yeah.
They use compressed nitrous there too, so that will actually can potentially change their hemoglobin. So you can also do it at any type of fires. I would also expect that if anybody given the cyanide kit, that you would actually see that number be manipulated.
So exactly, that's what I'm going to dive into. Again, that goes back into our profession, what we do, and obviously we're here for the citizens, we know that. But from a firefighter perspective and the likelihood of our exposure, that's a huge beneficial number. Especially when we're talking about potential treatments and, again, applying these numbers to context to our treatment plans. That could constitute, hey, further treatment, cyano kit, administration.
I would see the CO up. I would actually see the SPET-MET starting to be up higher because the cyanide is affecting their hemoglobin. And so then I would give that, and my number would go up higher, but the CO would actually go down lower. So perfect.
Pretty neat number, right?
Yes.
So the last thing that this thing will do, remember there's 4. We've talked about oxygen saturation. We've talked about SPCO. We've talked about SP-MET. Now let's talk about perfusion index.
Now, since we're going to talk about it, how come the perfusion index doesn't show up?
Let's cycle it through so everybody can see. So if you look at the bottom, everybody's seeing those numbers cycle. So right now it's only showing 3, right? So we're seeing oxygen saturation, SPCO, SP-MET. So we can manipulate, and we can manipulate this setting. Sometimes it's just turned off. So we're going to show you how to turn it on.
So remember, like Jake said, we're going back to, we're going to highlight it. On some monitors, a lot of times the perfusion index is turned off. I know at station 17, it's always turned off. You have to turn it back on. But we go over here, we highlight it, we turn it on. So I went over, I highlighted the PulseOx. About 3/4 of the way down, it says PI monitoring. You can see it is turned off. And now I just turn it on.
And again, it should be a different color once we get the highlight off of it. Oops. Just to make it distinguishable so you can see, hey, this is different. This is a different reading. So we talk about perfusion index.
There it is. There's my perfusion index.
So what is it?
So perfusion index is actually showing, so remember this PulseOx is reading right here at this fingertip. So perfusion index is actually going through and measuring how much blood is actually going through that capillary space at that moment in time.
It's the quality of the arterial pressure at that location.
At that location.
So realistically, the higher the perfusion index, the more accurate the reading you're getting as far as pulse oximetry, all those type of things.
Correct, and also because it's showing that I've got a lot of good blood flow down there.
Yeah, okay. So can it tell you like perfusion status? Can it tell you, obviously perfusion index, but can it tell you shock status, those type of things?
Well, yes, because if I'm getting a low perfusion index reading right there, then we can actually correlate that with the piece of the pie, like you said on the puzzle earlier. I have somebody who, let's say that they've said, oh, I've had one episode of vomiting blood, and you get there and you don't see the vomiting blood, but you put the PulseOx indicator on, the perfusion index, and all of a sudden you're looking at low numbers across the board, you can actually say this patient is actually more hemodynamically unstable.
Yeah. So again, another beneficial number, right? It tells us a lot of things. And again, applying those numbers to context. Now we got to figure out the numbers.
Okay.
We haven't talked about that yet with perfusion index. So what's the normal range for that? What's the normal number?
Well, so the way my understanding is reading through the Zoll stuff is usually less than 1, we're pretty good. So when we start looking at 1 or greater, then we've got to start looking at what's the diagnosis. Why do we have those numbers?
So what are you currently sitting at, Dave? What is your current perfusion index?
So my current one is 2.6. So, but it's kind of interesting. So it's reading, it's having issues. It's saying that my perfusion index isn't going real well. So less than 1 shows you have really good. What's the most common reason you'd have a high perfusion index, especially in the middle of January?
Cold.
Cold hands. So Dave's got actually very, very cold hands. So we just got to remember, warm up your patient. Look at that as your common reason.
If you see any sort of misreading there, again, it'll alarm. I think that's probably one of our biggest alarms we have on this monitor, to be honest with you. It alarms, look and adjust. It's one of those things, if you see a misleading number, understand, could it be applicable to the patient? It could. But could it be just the technology itself failing? It could.
It could.
So just understand, just because you might see a misleading number, could be accurate, it might not.
Look at it, the whole content.
Correct.
Now, if I happen to be the geriatric in the middle of a nursing home and I've got that UTI smell and I've got an altered mental status, that perfusion index would actually lead down the road of, hey, my patient could be septic. So it's all based back when you said, look at the context.